more the third and fourth years, and hopefully everybody gets a chance to experience this. I'm a third-year medical student. That means I'm MS3. And you know what? You might as well put an MD after my name, because I'm post-USMLE. I can tell the difference between AR, MR, stenosis, and my Steph has become a part of me. And if you lie still enough, I may hear a murmur that's benign, especially when you lay back flat and supine. My pen light brightens the earth. My reflex hammer always produces a bilateral +2 knee jerk. The nurses upstairs, they respect me. The staff here considers me essential. Give me any symptom and I'll give you the appropriate base differential. I write addendums to the attending's progress notes. Patients get nervous when they see yours, but they relax when they see my white coat. Because baby, I can electrify you like ECT, make you all erratic like alcoholics PT and APTT. I ride 5 days of pediatric fever like a Kawasaki motorbike. I am the voices of the voices in the heads of the patients in psych. One-handed, maybe two-handed, I can tie knots with both hands tied behind my back. I storm your thyroid and make you feel heat. Can differentiate leg calf herpes from skiffy by pattering of children's feet. House is actually a show based on us. It's a fact. I spill so much knowledge that even Ryan Chaddock ain't got no questions to ask. Marco made me do it. I melt the hearts of the people in Newark like zymogens do the pancreatic ducts. Be sensitive enough to return even the hardest of patients back to Moreau's sign and the rooting suck. I'll make you static. Treat your hypercholesterolemia. I'll even hand feed you if you have anorexia nervosa or bulimia and keep it down. And if it doesn't, I'll NG tube you without a single gag. Diagnose your renal cell carcinoma if your scrotum feels like worms in a bag. I can calculate your electrolyte imbalance in seconds in my mind. Nitrate, sodium, potassium, and magnesium in an Indian accent of a nurse in no time. I can make rails and crackles, snap and pop, increase your systolic and make your diastolic drop. When you have SIDH, I can make you be pure H2O. And if your kidneys fail, tell you it's green by fringent amyloid with red Congo. I am sweet enough to make your breath fruity with DKA, but provide you with bicarb, insulin, calcium, and glucose to save this day. I will raise your catecholamines with a check of lymphadenopathy because these fingers obliterate substance P. So, honestly, this finger, this one has PTSD. Maybe both of them would. But I always face into the ceiling. And all of what I just said is as true as tropical screw, which you'll never see. Because most of the things we took, you'll never see except in your biochem book. And to tell you the truth, my progress note doesn't really count. And my attending doesn't really know my name moving around. And my white coat is pretty dirty and makes me look like a waiter. And Newark is so polluted that I gave asthma to Darth Vader. Or maybe COPD. I still don't know if that's lymph node or cancer. And when I look smart, it's because my PDA gave me the right answer. About those murmurs I talked about before, I still can't tell the difference between AR, MR, MPR, BM, or flatus. And I maybe met the guy once who gets the responsibility to degrade us. You want to know what I really learned this year?
What?
How to look calm when I should really feel fear. How to stare long enough after being pimped that the attending asked the person next to me. That no one in this hospital really knows how to properly read an EKG, no matter how many times you learn it. That Bates Step 1 book's ethics caring should be put into a bonfire so you can burn it. Because there is no value here for patient-centered care. I've learned how, when I'm lazy, to take the elevator up one flight. And when everyone looks at me funny, fake like it was an accident to avoid the fight. forgot, I gotta go up one floor, I'm sorry. I've learned how to shoot down gunners like a video game because staying an hour late just because you want to should be shamed. I've learned to sleep as much as possible when nobody can tell. During morning report and noon conference is probably ideal. It's a good sell. Step 2s, matches. I've learned that we are all probably going to have stress ulcers from thinking about residency. Step 2s, matches, student affair, info sessions, the registrar, and lotteries. At a certain point, you'll need to boost your own morale because no matter how hard or little you work, you'll probably get the same grade on your eval. And find free food wherever you can and stay weird from the cafeteria unless you don't mind Shigella, Salmonella, and Listeria. I've learned that I still don't know what the hell oblique light means and how to find JDD. And that every one of our patients has done heroin, cocaine, and PCP, and probably has HIV, Hep C, and gonorrhea, a yeast infection and syphilis maybe, oh yeah, and TB. I know what feces and vomit mixed together smells like when wrapped in a hospital sheet, and that it doesn't even compare to some of our patients' decubitus, full, rotten, gremlin feet. I've learned that most surgical residents are douchebags. No matter what you do, and that's okay, because I can still be fine with love and friendliness over here. Anyway, what I really learned is that if you try hard enough, you can still make a difference, though sometimes it may be rough, that you can get the chance to listen to somebody's heart when no one has in a long time, that your hands may have been the first human contact they've had since 1969, that even though you can't prescribe yet and your white coat isn't down to your knee, you will be soon, and this might sound cheesy, we have a purpose here if no one else can see. So what the hell, I'm still a freaking superhero that drinks his Diet Coke with Borrelia burgdorferi, that's lime. And through all the chaos, I'm still looking for a few smiles and a couple of rhymes. My brothers and sisters, I'm a freaking MS3, and you can call me doctor and stamp me with my freaking MD.